Today, class, we're going to learn a little bit about mental health problems. And this is just going to be kind of a quick overview. If you decide to go on in your nursing career, you will actually do mental health rotations when you go on for LVN and for RN. But as a CNA, we're just going to kind of give you a quick introduction into what mental health problems are. So when we talk about causes of mental illness, it's what mental illness is it's not being able to cope or adjust to stress in healthy ways. So stress is a normal part of life. Okay, it's normal to have stress in your life. It's normal to have some anxiety in your life. But when those stressors become so difficult to you that you can't function anymore in doing your normal activity of daily living, of fitting in society, then we have a problem. Okay, then it's going to be considered a mental health illness. And we think of stress as just being a negative thing, but even positive things cause stress. A wedding causes stress. Having a baby causes stress, even though it may be a very happy event, but it can still cause stress. Other things that can cause mental health illnesses is chemical imbalances. Some people actually have chemical imbalances in their brain. Genetics, there are some of our mental health illnesses, there's strong genetic tendencies for them. Drug and substance abuse can cause mental illnesses, and social and cultural factors can impact this as well. So when we talk about a person's personality, it's a set of attitudes, values, behaviors, and traits of a person. So if we remember back to our Maslow's hierarchy of needs that we learned about in those first couple weeks of school, and Maslow said that the bottom part of our pyramid, he gave us our pyramid of needs. And that bottom part of the pyramid was our physical needs: food, shelter, water, clothing. And if we don't have that, we can't achieve anything else on that pyramid. Okay, because we have to have those basic needs met first. Then came safety and security. We said people have that need to be safe, to feel safe and secure in their environment. Then we have love and belonging. People need to feel like they're cared about and have a sense of community, have a sense of family and purpose. And then if those things are met, then hopefully self-esteem develops. Okay, and self-esteem is your sense of self-worth. And then the top part of that pyramid was self-actualization, of reaching your full potential. So Maslow's theory on this is your personality, if you don't have your basic needs met, your personality isn't going to develop correctly either. Okay, and so growth and development also affect that personality. When we were looking at growth and development, when we went over that chapter of some of those milestones that people go through from infancy all the way through adulthood, some of the changes and some of the growth and the development tasks that happen. If the growth and development are not proceeding like they're supposed to, that is also going to impact personality. So if there's something keeping from growth and development happening, then our personality is going to be impacted as well. So the first problem we're going to look at is an anxiety disorder. And anxiety is a vague, uneasy feeling in response to stress. And it frequently happens when a person's needs aren't met. So if those physical needs aren't met, if that safety and security isn't being met, if they don't have a sense of belonging or community, they're going to have more anxiety in their life. And some anxiety, it's normal, okay? I give you a test, it's normal to feel anxious about it. You're told that you have to pass the test, with a 70% or you can't go to the next module. Normal to feel a problem with that, okay? So people with mental health problems tend to have higher levels of anxiety. So some anxiety we're okay with. Anxiety to the point where it's keeping you from necessarily functioning in your daily routine, in your work routine, with your activities of daily living, then it becomes a problem. Okay, then it's considered a disorder. So some symptoms that people have when they do have headaches, and they don't have to have all of these, but some people will say, gee, they feel sick to their stomach, or it feels like their stomach's just stomach pains, or that they've got butterflies in their stomach, or they're shaky and trembly, or having sensations of pins and needles. Some people complain of their heart just racing like crazy, and beating in their chest really hard. That's palpitations, or chest pain, or shortness of breath. Headaches, dry mouth. Some people overeat when they're feeling stressed and anxiety. Some people don't eat. So you can see that kind of go both ways. But these are really common symptoms when a person is having a lot of anxiety, and these symptoms are going to be able to keep them from being able to function okay. So generally when a person does have anxiety, or with this next one with panic disorder, generally how they treat it is with behavioral therapy. And there are some medications a person can take to help with this, but generally they try to get them in for like a behavioral treatment, and just to be able to talk about it, learn other ways to cope and deal with these high levels of anxiety. So anxiety stressors that, are keeping the person, really stressed out, to the point where they're having a hard time functioning okay. Panic is actually considered the highest level of anxiety. It is an intense and sudden feeling of fear, anxiety, terror, or dread. And a panic attack can last from 10 minutes or even longer. And it is so intense that it literally will keep them paralyzed. It will keep them from being able to function during that time frame. And I thought this was kind of cool. The picture I found here was one of someone doing public speaking. They say public speaking is one of the most anxiety producing and panic disorder inducing things that people do. A phobia means an intense fear. An intense fear. And it's an intense fear to an object or situation or an activity that actually doesn't really have any danger involved to it. So we're not talking about, you see a black widow, that is potentially dangerous. You would be concerned. You would want to make sure you get away from it, you'd want to kill it. But we're talking about, let's say you have a phobia to spiders, and any spider, even just a little tiny spider that can't harm you in any way, and you have this intense fear to the point where it's keeping you from being able to function appropriately. It causes such a high level of anxiety that you can't function because of it. So, we're not talking about any intense, if the intense fear that you're feeling is actually because, let's say you're on a ledge and you could potentially fall off because you're so close to the end of it, you would have a fear of that. But if you just come up to any height, even when you're in a safe area where you can't fall off of anything, there's actually no harm or danger to you, then it would be a phobia if that was still causing you problems to the point where you couldn't function with it. Obsessive compulsive disorder, we tend to think of OCD as all in one thing, but actually some people just have obsessions. An obsession is a reoccurrent, unwanted thought, idea, or image. And a compulsion is repeating an act over and over and over, a ritualistic act. And so normally we tend to see those lumped together, but they can actually be separate. Now, the term post-traumatic stress disorder, or PTSD, occurs after a terrifying ordeal. And we see this a lot with our military staff, when they're over in a war situation and they've seen, their co-workers get blown up, get shot up, or they've been shot at. They have this terrifying ordeal happen to them, and they tend to relive it. Okay. And we also see it with people that have been raped, that have been beaten, that have had just these really horrific things happen to them in their life, where physical harm or threat of physical harm has happened. So when people have PTSD, they have flashbacks where they're reliving that trauma in their thoughts and their dreams. And it may not start up until 6 months, maybe even after the event happens. Some people, it might not represent itself till even longer, but they continually relive the dreams over and over and over. Now, the term schizophrenia, it literally translates to the word split mind. It's a severe chronic disabling brain disorder. And there's a lot of symptoms that we tend to see with it. Psychosis, where a psychosis is when a person can't tell what's real and what's not real. So they have delusions and hallucinations. They have these false beliefs, and they can't tell what's real and what's not real anymore. So psychosis is not being able to tell real from unreal. A delusion is a false belief. Hallucinations are seeing, hearing, smelling, or feeling something that's not real. And hearing voices is the most common type of hallucination to get with this. Paranoia is where you're overly suspicious that everyone's out to get you, or everyone's laughing about you, or everyone's going to do something to you. So you're constantly suspicious of everyone around you. Now, delusions of grandeur. So a delusion is a false belief. A delusion of grandeur is an exaggerated belief of one's importance. So if I dressed up like Superman and I thought I could go fly all of a sudden because I'm Superman, that would be a delusion of grandeur. A delusion of persecution is where the false belief that one is being mistreated, abused, or harassed. So it kind of goes along. We tend to see paranoia and delusions of persecution kind of go hand in hand a lot of times. When the person has schizophrenia, and they usually have severe mental impairment, and the person has problems relating to other people, it's hard for them to just fit in with others. It's hard for them to organize their thoughts, and they don't always respond to people and situations appropriately. A lot of times the communication is disturbed. Now, I know sometimes we see on TV, we see people with schizophrenia that have violent episodes, but the majority of people with schizophrenia actually usually are not violent as a general rule. I mean, there are some exceptions to that, but as a general rule, most people with schizophrenia are not violent. Now, the term bipolar disease, it's known as manic depressive illness, manic and depression. So they're alternating between depression, where they're so sad they can hardly function. They don't want to get out of bed. They don't want to get dressed. They don't want to do anything. They don't want to go to work. They have a hard time just functioning because they're so depressed. And then they have periods of mania where they're just super, super happy, super excited, want to buy everything, want to do everything. It's just go, 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 go. And so they're alternating between those highs and those lows, just total extremes in moods of one end of being super, super happy and going to super, super sad. So it does tend to run in families, usually develops in late teens or early childhood, and it requires lifelong management. Now, there are medications for bipolar disease, and it usually takes medication and therapy on a lifelong basis, and it's really hard for people to buy into the fact that they need to do this for the rest of their life. So sometimes people will be really depressed. They might start their therapy and they're feeling better, so they don't think they need it anymore. Or they aren't happy having kind of just being a flat level mood with their medication, so they decide to to get off of it. So it's really hard sometimes. Most mental health illnesses, people need to be on medications on a lifelong basis here, and so that's really hard to get buy-in many times from patients. Now, major depression, this is going to be the most common mental health illness that we are going to see, and especially in the nursing homes. Depression involves body, mood, and thoughts, and it's to the point where a person is so sad that they're just so sad that it affects their ability to work, to study, to sleep. It impacts their eating habits. Some people with depression tend to overeat. Some tend to undereat and not eat. They don't want to do any activities. They don't want to get involved in anything going on around them because they're just so sad. They tend to lose interest in daily activities. Now, sometimes depression can happen because of a stressful event. So let's say they've had a death in the family. Let's say their spouse has died. So sometimes it's from an extremely stressful event to them that starts this. And physical disorders start to happen with depression. So when people are really, really depressed, they can also have physical manifestations. They can get sick to their stomach. They can have heart issues and chest pains and shortness of breath. And these are just very common. Hormonal factors can cause depression in women. So especially after menopause, you might see this happen more often. And it is very common in the elderly. I mean, you have to remember when we go into those nursing homes, this is a really common diagnosis to see. Because if you think about it, I mean, these people have had major disabilities. That's why they're ending up in the nursing home, because they can't care for themselves anymore. Their families aren't really able to care for them. So now they end up in a nursing home. So they had to leave their home. They're usually dependent on other people now. They have some deficits of activities of daily living, which is usually why they're there, and they get very, very depressed. And this is a really common thing to see when people do get admitted into the nursing home. We really have to watch them carefully because they go through what we call a failure to thrive. They just give up. they just give up because they're so sad. And so there is medication that can help. There are multiple medications for depression, and then behavioral therapy as well to help with it. I thought this was interesting. It says, part of me wants to help you with your crisis, Hargraves. Part of me just wants to go to lunch. We have to remember when we're dealing with patients that have mental health issues, we have to realize too what an impact it is for family members as well, for the caregivers. So you're going to find that when you're in the nursing home and you're taking care of people that have mental health issues or severe depression, it can be very exhausting because it's just such a sad environment that you're working in sometimes. And so it's also true when people are home. So when people have mental health illnesses and their families are caring for them all the time, and their families are trying to, um, help take care of them, you want to help you want to help the people, you want to help people that you care for, you want to help people that need it. And at the same time, sometimes it can just make you so exhausted yourself that there just comes a point where you just say, I just need a break. And it's okay to take a break. Okay, it's okay to take a break. And so generally when we have people that are caring for loved ones at home, we really encourage them, even whether it's a physical illness or a mental illness, when you're caring for a loved one at home all the time, we recommend that these people go and get some support groups. So there are support groups for caregivers out there that can help, okay, and just give the person a chance to just breathe. Okay, and know that they're not alone and that there's other people out there that understand what they're going through. Personality disorders. A personality disorder involves rigid and maladaptive behaviors. So what we mean by maladaptive, it means to change or adjust in the wrong way. So they have difficulty functioning in society. So personality, again, if your growth and development has not been going correctly, or you have a major event that happens in your life as you're going, as your personality is developing, or your basic needs of the Maslow's hierarchy of needs hasn't been being met, your personality, it can actually change or adjust in a wrong way that we don't, to the point where it's difficult for a person to function in society, okay, of what the general society considers the normal behavior. I thought this was cute. It says, actually, it's Jane who had mental health issues. John just likes to wear dresses. So but it's when people cannot function correctly where in a general society setting, they would tend to think of that person as doing okay. Now, substance abuse and addiction occurs when a person overuses or depends on alcohol and drugs. So substances involved in abuse and addiction affect the nervous system, and that's going to impact your mind and your thinking ability. So when we look at alcohol abuse, there are some terms that your book talks about. It talks about a craving, which is just a strong need to take a drink. You need to take a drink, okay? Loss of control. They can't stop drinking, okay? Once you start drinking, you can't stop. Physical dependence, where your body actually starts withdrawing. It shows withdrawal symptoms when you quit drinking. And tolerance. So let's say every day you come home and you have 2 beers after you come home from work. After a while, 2 beers isn't going to give you the feeling that you used to have from 2 beers. So now you're going to need 3 beers to get that same feeling. And after a while, it's going to be 4 beers to get that same feeling. So people build a tolerance to alcohol to where the effect that they're looking for with alcohol, they aren't getting it until they keep increasing it. So alcoholism is a disease. It is a disease. And when people say, well, why don't they just quit drinking? It actually impacts your brain thought processes and your chemical responses in your brain, and it is a disease. And they are going to need lifestyle changes to be able to cope with this. So there is a genetic component. They have found that if you have a family member, if your mother or your father is an alcoholic, you have an increased chance of becoming an alcoholic. If both mother and father combined were alcoholic, your chances increase even more. So some people turn to alcohol for relief from life stresses. You're stressed in life, you want to drink. Okay, even now when you're in school, we're going to tell you, find healthy ways to relieve your stress. Go for that jog, try the meditation, go do some yoga, talk to a friend. But you want to find healthier ways to relieve your stresses than to turn to alcohol. Craving for alcohol can be as strong as the need for food and water. So you know you have a problem, even if you only drink 1 beer a day, for instance. If all day long, all you can think about is getting home so you can have that 1 beer, and that's what's always in your mind. That's all I got to get through the day. I've only got 6 more hours. I can go home and take that beer. I've only got 4 more hours. I can go home and get that beer. Even if you're only having one, but it has become so consuming that that's all you can think about is going and getting that. You have an addiction issue. So alcoholism can be treated. It can be treated. It usually is behavioral therapy. There are some medications that can help with it, but it's primarily behavioral issues that are going to be worked on. Now, as far as drug abuse and addiction, drug abuse is the overuse of a drug for non-medical or non-therapy effects. It's a chronic relapsing brain disease. So again, this isn't something that it alters your brain patterns. It is not something that you can just tell the person, well, just stop doing it. It doesn't work that way. The person has an overwhelming desire to take a drug, and the person repeatedly takes the drug because of its effect. Now, same thing with tolerance. You take a medication, after a while, you're going to build a tolerance to it, and you're going to need even more to get that effect the next time. So, and eventually you're just going to keep needing more and more of that medication to get that same effect. So generally, the other thing that we show with drug abuse and addiction is the person can't stop taking the drug without treatment. They cannot do this on their own. Now, eating disorders, I thought this was cute. It says, I don't care what it said when you looked up your symptoms on the internet. You are not anorexic. Definitely not anorexic there. So we're going to look at anorexia and we're going to look at bulimia. Anorexia nervosa is intense fear of weight gain or obesity. And we tend to see it the most in teenage girls and young women. You can see it in boys as well. I actually have seen some boys have anorexia as well, but I would say it's much more common in girls and your teenage to early 20s. They believe they're fat even though they're dangerously thin. So you can look at them and they are so thin they look like they're sticks and twigs and bones, and they look at themselves in the mirror and they see a fat person. They have very poor eating habits. They avoid food. They avoid meals. They choose a few foods and they eat them in such small amounts that they really don't get enough to sustain themselves. And they weigh and measure food. Intense exercise and vomiting can happen. Some people will abuse laxatives and enemas to try to make the food go through them even faster before it's had time to fully be absorbed. And a lot of them will take diuretics. So diuretics are medications that will make you get rid of extra fluid out of your system. It does make you lose weight, but it also makes you lose electrolytes as well. It can be very dangerous. And so these people are high risk of death from cardiac arrest because their heart isn't getting enough food, isn't getting enough nutrients. Their fluid levels are going to get out of whack. Their electrolytes are going to be out of whack. It can actually stop a person's heart. And they're also at more risk of suicide when they're anorexic. So here's what I was talking about. You might see something like this, where their arms are so thin, every bone is showing in their body. But yet when they look at themselves in the mirror, they see something like this. Okay. And they do need behavioral modification. They do need therapy. Now, bulimia, on the other end, is where the person has binge eating. So the person eats large amounts of food, and they just eat. And then they purge it. They try to get rid of it to prevent weight gain. So they eat all this food, and then they go make themselves throw up so their body doesn't have time to absorb it. Or they'll give themselves enemas and laxatives and diuretics to make things come out the other end. So now the problem with bulimia is people tend to look a normal weight. They don't look super, super thin like what we saw with the anorexia. They actually look like a normal weight person, but they will go through periods where they will eat so much food that you're like, how could any person possibly hold that much food? And then they'll just go into the bathroom, they can make themselves throw it all up. So it doesn't have the opportunity to cause weight. Very, very dangerous. Think about all those acids in your saliva and in your stomach that are being secreted into that food. And now you make yourself throw them up constantly, and all those acids tend to erode the esophagus. It can cause bleeding of the esophagus. It can cause cancers of the esophagus, and it can kill a person. Okay, so it's very, very dangerous. Now, suicide means to kill oneself. And suicide was the 10th leading cause of death in the United States. Firearms are more common in men. Poisonings are more common in women. Very common in your teenage young adult years. So and maybe you were lucky, maybe high school was a great time for you, but for many people it is a horrific time. Okay, bullying goes on. If you don't fit in with the crowd, if you don't look like everybody else, if you don't think like everybody else, you're ostracized in high school. And it is such a difficult period for many kids, and it is very common for teenagers to actually try to commit suicide. So people think about suicide when they're feeling hopeless. So if a person mentions or talks about suicide, please take them seriously. Even like in school, okay, in our class, if someone is, let's say you're in clinical and your classmate is like, oh, I'm really thinking I would just prefer to kill myself. And I take them seriously, because if somebody's even joking around about it, it means they are thinking about it. And so we want to take the person seriously, and we want to let somebody know. So you can either let your clinical instructor know, you can let me know, you can contact the health center. Okay, they actually have support groups. There's suicide hotlines that we can contact. So we need to get this person help, and we don't want to try not to leave them alone if we can. So I am going to tell you this. Sometimes you'll have a resident tell you, oh, I'm going to tell you something, but you got to promise not to tell somebody else. You never take that promise, because you're not going to be able to do this. If somebody is threatening suicide, or somebody's telling you that they're thinking about suicide, you have to go tell the nurse. You are required, you are obligated to tell the nurse. Okay? You can't think, oh, well, they're probably not going to do it. What if they do it? And you could have stopped it. Okay? So when a person starts a conversation like that with me, I'm going to tell you something, but you've got to promise not to tell anybody else. I always tell them, and I am happy to listen to you and talk to you about whatever you'd like. But if it's something that could potentially harm you or affect your treatment, I will have to pass that on. And I just tell them that up front, because that's not a promise I'm going to be able to keep. All right, and that's going to end this section.